Yeah, the lab tests are at best an indicator that you've been infected by Borrelia. It doesn't tell you how bad it is. It doesn't tell you, kind of, sometimes it tells you that it was in the past or that maybe it's more acute. But there's really very little diagnostics that confirm something 100% like many other tests. You know, that you have a staph infection or, you know, you have a strep infection, whatever. It's really more vague. And according to the CDC, their training for doctors is that you don't use the test. Just leave it out. It's 100%, it's 50% accurate. So it's 100% useless. You know, if you get a false positive or false negative, you just don't know. And if you have Lyme and it says it's negative and you don't treat it, you're in trouble. If you don't have it and you start treating it, well, you know, antibiotics is not a vitamin, it's a poison. And so then you're hurting yourself and you have some other problem. So using that test is not good. You rule out any other infection that's according to the CDC. If there's nothing that, you know, shows up, and you look at the symptomology, you know, the joint pain, maybe the rash, although that doesn't show up very often, the bullseye doesn't show up very often. Has the person been bit by a tick? Are they in an area? So there's all this criteria according to the CDC of how to treat it, but ultimately the only treatment is 3 weeks of doxy. So that's the treatment. So I'm a muscle tester. I use muscle testing to determine should I treat this person for Lyme disease. So I start with this basic standard of care in Western medicine criteria. Is it something else? And if we've ruled out everything, if all the tests have been run and the person's been going to the doctor and saying, there's nothing wrong with me, then I do a muscle test. And what I do is, like, how would I treat Lyme disease? I would use the Lyme nosode. I would use whatever antimicrobial is best for Lyme disease. And if they test for it, then I suspect, oh, you have Lyme disease. You're not going to test for Lyme nosode if you don't have Lyme. It just doesn't work that way. You only test for what you have. And so I use that test, and then we start the treatment. And if it's ineffective, then maybe there's a co-infection that's actually more important to treat than the Borrelia. Your immune system may have the Borrelia pretty much handled, but because of a co-infection, Bartonella, etc., your immune system may be so tied up it can't finish the job. So then you have to treat those secondary co-infections. They may even be old infections like Epstein-Barr, which is keeping your immune system from coming up 100%. So you have to look at the whole range of infections, not just the Borrelia, for some people to come out of that. And I find muscle testing is the most accurate way because, well, we don't have anything else. So we have to do something. And if the person gets better, we consider that a win. Muscle testing would be, I might put something in your hand, like if this is vitamin D. If you had a vitamin D deficiency and I put it in your hand, if your body wanted it in this hand, it would be weak. And I would think, oh, maybe your body needs vitamin D. I might put it in this hand then, and if your body's strong, then I think, your body's strong with it, it's weak without it. This would be the takeaway hand. So I would say, I think vitamin D is appropriate. Then I could check and see what dose of vitamin D is appropriate. And so I have some checks and balances to make sure that, you know, if I put something else in there, you wouldn't respond the same way. But muscle testing is basically accessing your body's intuitive perspective. You know, your body's going, oh, I like that. And it's just like with people. You know you like certain people, you know you don't like certain people, and you don't know why. But your body knows why. Your body gives you that information. And so you like certain supplements, and you don't like certain supplements. And your body knows that, but I or you may not know that consciously. So you want to work on that level and let your body tell me what it needs. And that also gives me all the levels. Are you in the acute phase? Do I start there? Are you in the repair phase? Do I start there? Are you almost done, but it's still nagging you and certain things are bothering you? Well, we need to work on that. Because if you're in the third phase where we're just doing repair and maintenance and strengthening, and we start a whole rigorous antimicrobial thing, you're missing it. And that could even make you feel worse. So You got to find that right place, and that's where I think the muscle testing is most appropriate.